Ladies and gentlemen, all of the participants, we would like to inform you to please have a seat because in a few minutes our event will be started. Thank you.
Good morning, ladies and gentlemen. Welcome to the Pullman Bali Lekian Pit. The first, please allow me to introduce myself. My name is Eko Mei, as security manager at this hotel. I will share safety briefing before meeting start for all ship. The first about location. Location Hotel Pullman Bali Lekian Pit on the Melasti Street number 1, Lekian Village, Kuta District, Badung, Regency, Bali, Indonesia. By parameter north side, the Legian Pit Hotel, east side, the 14 Rose Hotel, south side, the Alam Kulkul Hotel, and west side, Legian Pit or Kuta Pit. Total hotel Pullman land, 2.3 hectare with 365 rooms divided by 8 building level. The lower, we call it basement 2. Your location no, at basement 2. Basement 2 is ballroom and parking area. The next, we call it basement 1. Basement 1 is meeting room, offices, Muslim prayer room, parking area. The next, we call it level 1. Level 1 is lobby, restaurant, swimming pool, hotel clinic, fitness center, meeting room, and assembly point for fire and assembly point for earthquake. Location at Temple Yard in front of the lobby. The next, we call it level 2, guest room area and meeting room. Level 3, guest room area and swimming pool. Level 4 and level 5, guest room area. And level 6, top level, empty area, we use it for tsunami assembly point. For emergency numbers, if any urgently, please dial number 5 from your room. For emergency service, hotel clinic open 24 hours, international hospital at the Sunset Road, 15 minutes from hotel, police station at the Kuta Beach Street, 5 minutes to hotel, and fire brigade at the Majapahit Street, 10 minutes to hotel. For emergency equipment, Hotel Pullman completed by master control fire alarm full addressable, completed with smoke detector, heat detector, fire extinguisher, fire ansel, hydrant building, hydrant area, also CCTV. For emergency, to be informed, today we doesn't have evacuation training plan. It means if any alarm active, any evacuation instruction, it's real. We hope nothing happen. I mean, for fire emergency, if any instruction for evacuation, please don't panic. Please save your equipment thing. At least attend meeting to be safe. And then open the first door and going up to the basement 1 and going out from a wooden door. There are 2 doors, glass door and wooden door at the basement. Out to the wooden door. This is direct access to the assembly point. And then our team will assist you. For earthquake emergency, if any earthquake, please don't panic, don't run out from this room. Still inside, protect your head from something easy broken, something easy fell down. Until the trigger slow down, please go to the assembly point, the same location with fire assembly point in front of the lobby. At the assembly point, we waiting instruction for disaster department. This a quick tsunami impact or not. If not, you are allowed back to the meeting room. But if tsunami impact, we will assist you, escort you to the tsunami assembly point, to the rooftop. And then our team will assist you. When evacuation, please don't use elevator, still use staircase. That's all our safety briefing. We hopefully this meeting runs smoothly and success. Thank you.
Ladies and gentlemen, the GHWP 2024 will be started. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, greetings of goodness and may peace upon us all. Good morning, ladies and gentlemen. Welcome to the opening ceremony, Global Harmonization Working Party TC Leaders Meeting and Capacity Building, Excellence on Medical Devices Regulation and Innovation 2024. Let me welcome the distinguished guests who have joined us this morning, whom we honor. Delegation from Ministry of Health Indonesia, Director of our Medical Device Production and Distribution, Mr. Dede Mulyadi, Director for Medical Device Control, Mrs. Eka Purnamasari, Director for Pharmaceutical and Medical Device Resilience, Mr. Roy Himawan. Chairman of Gakeslab Indonesia, Mr. Raden Kartono Dwijo Suwoyo. Chairman of GHWP, Dr. Sujingha. And also honorable VIP guests, even participants, and all the audience. Welcome, ladies and gentlemen. Welcome to the opening ceremony of Global Harmonization Working Party TC Leaders Meeting and Capacity Building Activities, Excellence on Medical Devices Regulation and Innovation 2024. Please give a round of applause to all of us here. And before we start the whole event, as our gratitude to God Almighty, so that our activities can run well and smoothly, let us listen together to the reading of prayers. Will be led by Dr. Irfan Gunawan. We welcome you.
Ladies and gentlemen, all delegates and also participants, first of all, please allow me to lead this praying session in Bahasa. Assalamualaikum warahmatullahi wabarakatuh. Mari sebelum kita memulai untuk acara GHWP ini, kita sama-sama memanjatkan, menundukkan kepala untuk berdoa menurut agama dan kepercayaan masing-masing. Bagi yang beragama Islam dapat mengikuti saya. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalam wa ala asyrafil anbiya wal mursalin wa ala alihi wa ashabi ajmain. Amma ba'du bi rahmatika ya arhamar rahimin. Ya Allah, ya Rabb kami hari ini berkumpul pada hari yang berbahagia ini untuk dapat saling bersilaturahim dan juga mendapatkan ilmu serta mendapatkan keberkahan darimu. Ya Allah, kami senantiasa memohon ampunan-Mu, mengharapkan ridho-Mu dan juga kelancaran untuk seluruh rangkaian pelaksanaan acara GHWP ini hingga selesai nanti. Ya Allah, ya Rabb kami juga memohon keselamatan untuk acara ini dan juga untuk seluruh delegasi dan juga peserta serta panitia dan seluruh pihak yang mengikuti acara ini hingga kami nanti dapat berkumpul kembali dengan keluarga kami masing-masing. Rabbana zolamna anfusana wa ilam taghfir lana wa tarhamna lanakuna minal khasirin. Rabbana hab lana min azwajina wa dzurriyyatina qurrata a'yun waj'alna lil muttaqina imama. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wassallallahu wasallam Muhammadin wa ala alihi wa ashabi ajmain. Subhanaka rabbil izzati amma yasifun. Wassalamu ala mursalin walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Irfan Gunawan, who led us in prayer. Ladies and gentlemen, Bali has a lot of culture and also beautiful things. As our warmest welcome to all of you, let's watch together the welcome dance of contemporary Balinese dance from the studio Belbi Bali. Enjoy.
We'll be right back.
Please give applause, ladies and gentlemen. That was a beautiful dance from Bali. As our warmest welcome to all of you. If we can see the meaning of that dance, that beautiful dance, Tatuam Asih means I am you and you are me. The dance presenting the joy and the enthusiasm of young people in harmonizing Buana Alit and Buana Ago. So that nature continues to have a deep sense of joy in life. And we hope that you can feel the joy and memorable moment in here, Bali. Next, let's listen to the report of the chief executive of the activity. We are pleased to invite Director General of Pharmaceutical and Medical Devices, Mrs. Dr. Rizka Andalusia, represented by Mr. Roy Himawan. We welcome to the stage.
Good morning, Shalom, Om Swastiastu, Namo Buddhaya. On behalf of Director General of Pharmaceutical and Medical Device, Ministry of Health, Republic of Indonesia, Dr. Lucia Rizka Andalusia, I would like to deliver her warm welcome to distinguished participants today and convey her remark on this beautiful morning. Distinguished speakers, honorable guests, regulators, medical device industry representatives, and stakeholders, ladies and gentlemen. First and foremost, let us extend our gratitude to God Almighty for His blessings and allow us to gather here today for this significant and beneficial event, the International Meeting for Regulatory Harmonization, Global Harmonization Working Party, or GHWP, which is held in conjunction with capacity building with the theme Excellence in Medical Device Regulation and Innovation and Business Matching. This event is an important moment for us in strengthening harmonization of medical device regulations at a global level. This harmonization is crucial to ensure that every medical device on the international market meets the agreed upon safety and quality standards. With standardized regulations, we can increase public trust in the medical devices used while also fostering innovation and technological advancement in medical device sector. I would like to commend the efforts of the GHWP in facilitating dialogue and cooperation between countries. The GHWP has proven to be an effective platform for us to share knowledge, experience, and best practices in medical device regulation. Such collaboration is essential, especially in facing global challenges. Ladies and gentlemen, the Ministry of Health of Indonesia is currently transforming the Indonesian health system. The health transformation consists of 6 pillars that focus on health system, which include primary service, secondary service, health resilience, health financing, health workforce, and health technology. The cornerstone or to support this healthcare transformation is the enhanced access to safe, high quality, and innovative medical devices. This access will only be available when supported by harmonized regulation, human capacity, and market access. The harmonization of medical devices regulations on a global level is therefore of utmost importance to provide the access. It ensures that all medical devices circulating in the markets adhere to stringent safety and quality standards and ultimately safeguarding the public health. On this occasion, I also want to highlight the importance of capacity building in medical device regulation and innovation. This is aims to ensure that regulators and industry professionals are in the same perspective on having the knowledge and skills necessary to navigate the ever-changing dynamics of the medical device sector. Through this capacity building excellence in medical device regulation and innovation program, I hope we can cultivate professionals that are capable of driving effective and innovative regulations. Moreover, this event also provides a valuable platform for business collaboration opportunity for stakeholders in the medical device industry to meet, excel the network, exchange information, and explore new cooperation opportunities. Strong collaboration between regulators, industry, and other stakeholders is essential to drive innovation and ensure the availability of safe and quality medical device in the market. I believe that through regulatory harmonization, capacity building, and effective business collaboration, we can achieve our shared goal on enhancing public access to safe, high quality, and innovative medical devices. Let us continue to work together and commit to achieving this mission. Ladies and gentlemen, in this sense, I do believe that this event will provide us with a useful insight to support the development of our health system and build a strong foundation for the outbreak and epidemic preparedness. I hope the event will be a great success. I highly appreciate the efforts done by all parties who have contributed to organize this meeting in Indonesia. My discussion and collaboration we undertake today bring significant benefits to the future development of the medical device sector. Let us continue to collaborate for mutual progress. Lastly, most of Indonesians now are very happy and full of passion due to our soccer national team has qualified and passed the third qualification of World Cup. So, with the same happiness, with the same passion, I wish you all have a productive deliberation, successful and productive event, but later, do not forget to also indulge yourself in the exquisite beauty, hospitality, and richness of Bali. Thank you.
Once again, ladies and gentlemen, that was the report of the Chief Executive of the activity, Mr. Roy Himawan. Thank you. And next, we welcome the Chairman of Gakes Lab Indonesia to give a speech to Mr. Raden Kartono Dwijo Suwoyo. Please welcome to the stage.
The Honorable Director of Pharmaceuticals and Medical Devices Resources, MOH, Mr. Roy Himawan, S-Farm Apotheker MKM, Director of Production and Distribution of Medical Devices MOH, Mr. Dede Mulyadi, SKM MKes CRMP, Director of Medical Devices Supervision MOH, Dr. Eka Purnamasari Apotheker MKM, GHWP Leadership, Dr. Zhu Jinghe as Chair, GHWP, and Dr. Abdul Latif as Chair, GHWP TC. Strategic Advisor Board TC Leaders and TC Advisor, WG Chair and Co-Chair, STG CRP Acting Chair and Acting Co-Chair, and other participants. Cindy Pillow, Manager Regulatory Affairs of APACMed. Devi Bharati, Associate Regulatory Affairs of APACMed. Delegate from USA, Netherlands, China, Dubai, Japan, Germany, Canada, Korea, Malaysia, Saudi Arabia, Singapore, and Taiwan. And all the participate from the capacity building events and distinguished guests. Good morning and welcome to Indonesia, especially in Bali. For our fellow countrymen, selamat datang di Bali, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. We Gakes Lab Indonesia, the Association of Indonesian Medical Device and Laboratory Equipment Enterprises, are honored to be invited by our Ministry of Health to participate in this event. Despite the differences of challenge and accomplishment in our each respective country, I wish you to have a productive and successful conference. There is no denying that the healthcare environment that we are facing in our time are complex, dynamic, and wide-ranging. I am confident and convinced that we will find commonalities and pathways to reach solution. I bid you success and very pleasant stay in my country, Indonesia. Association of Indonesian Medical Devices and Laboratory Equipment Gakes Lab Indonesia, established since 1977. We have 1,500 members in 26 provinces, powered by SME, 80% of our membership, and then 95% is local companies, 5% if foreign direct investment companies. Our member supply chain coverage, one is a component manufacturer, medical device manufacturer, logistic and distribution, calibration and after-sales service, waste and environment management, and regulatory consulting. As you can see that these are the complexities. Next. These are the complexities that our industry in the MOH are facing and then today, and it's the ever-changing and fast-moving environment. As you can see that we have from pre-market until the post-market. Next. GAKES Lab has been steadfast partner and working closely together with MOH to develop progress to support our MOH's various policies. GAKES Lab Institute and capacity building partnership. We have CDAKB training with good distribution practice medical devices since 2022. We have conducted 37 trainings in 2023 alone. And CPAKB training, that is good manufacturing practice for medical devices since also 2022. We have also Halal Task Force, official MOU with Kesehatan, Indonesian Halal Training and Education Center in 2024. Go Indo, that is GAKES Lab Innovation Industry, Downstream Industry Development. And we have also partnership, streaming innovation to commercial of medical devices, MOU with 14 research institutes, and business matching session between innovators, healthcare, professional industries, distribution, and customer. We done this also already so many times that we try to make all the production in Indonesia we can also consume by the Indonesian government and also export to other countries. And we have also collaboration with embassy from many countries, B2B program. And we have also industry exhibition and visits, and we also have exhibition in Dubai and Turkey, and we get also requirement very good, and also we already export to many countries, and I hope we can more and more we can export to other countries. In this event, we have been assigned and we have developed the following programs for our industry participants. CDAKB training session, GDPMD. We have also sharing halal knowledge session for medical devices cooperation with iHigh-Tech, the first in the Indonesian for medical devices industry. Capacity building session for medical devices industry. Artificial intelligence, software, and robotic in cooperation with Philips. Update and on regulation implementation of healthcare omnibus law, and then for the topics such as healthcare software, radio frequency devices, and testing of radio frequency medical devices. Evaluation of registration process for radiation in electromagnetic devices in cooperation with Bapeten, that is Atomic Energy Monitoring Agency, and local content certification of medical devices with Ministry of Industry, official MOU with Sukovindo, and we have also clinical research for medical devices. And we have also discussion session on post-market surveillance, life cycle IVD, LDT, validation personalized medical devices in cooperation with APACMed. progress in regulation and compliance. The Republic of Indonesia Ministry of Health have been the leading and effective force in adapting with ever-demanding and fast-changing regulation environment. Established of the six-pillar health transformation plan as a national strategic direction, strengthening monitoring and implementation function to ensure product safety and quality in manufacturing and distribution, streamlining and upgrading product evaluation and registration process to become a very efficient and transparent process. Cross-ministry and agency collaboration with the Ministry of Health, Ministry of Industry, Telecommunication, and Ministry of Investment. We have also open door policy to involvement and participation from various stakeholders. As you see, Gakes Lab is the gateway in the Indonesian medical devices. We collaborate with investors seeking high growth opportunities, manufacturers looking to expand global reach, distribution seeking new market, researchers collaborating with local institute, companies seeking for general information about Indonesian medical devices market and regulation. Thank you very much, and I hope this meeting will be great, and then everyone can achieve what they trying to do in the Indonesian market. Thank you very much.
Once again, thank you so much, Mr. Raden Kartono Dwi Josowoyo. Please give a round of applause once again, ladies and gentlemen. Next, we will hear a speech from the chairman of the GHWP. Please welcome Dr. Xu Jinghe.
Dear friends from the Ministry of Health of the Republic of Indonesia, dear friends from the GHWP, dear friends from the industry, good morning. Selamat pagi. 早上好. I'm Jeffrey Xu, GHWP Chair and Deputy Commissioner of China's National Medical Products Administration. I'm more than delighted to be here with you on this paradise-like Indonesian island, Bali, to take part in the GHWP TC meeting. Over the many years, the Ministry of Health of Indonesia has attached great importance to the work of GHWP and take part in the many activities related to the GHWP. In November 2011, the 60th GHWP annual meeting was held in Bali. Mr. Ruby is the former vice chair. Now, Ms. Eka is our current vice chair. At the 2023 GHWTC meeting held in Shenzhen, China, the Ministry of Health of Indonesia was voted by TC leadership as the host of the first 2024 GHWTC meeting. On behalf of GHWP, I would like to express my sincere appreciation for the remarkable contribution made by the Ministry of Health of Indonesia to the convergence, harmonization, and reliance of global medical device regulations. Thank you for your offering this valuable opportunity to enable friends from all over the world to get together on this charming island with representatives from Indonesian regulatory authority and the industry to have communication and exchanges. GHWP is one of the longest standing and the most inclusive international organizations in the global medical device regulation. It's the only international platform for the exchanges of medical device regulation that is driven by the collaborative efforts of regulators and the industry. The vision and mission of GHWP are to promote open and trust-based efforts between regulatory authority and the industry based on latest development in regulatory science, accelerate regulatory capacity building among the member countries and the region, and promote medical device regulatory convergence, harmonization, and reliance across the globe. It's the lofty and arduous mission. GHWP has its own unique advantages in promoting global medical device regulations and sustainable development of the industry. In 2023, we established the new leading team and optimized management of the TC work groups. Building on years of development, GHWP continues to grow and has made remarkable achievements. By now, GHW membership has increased to 34 countries and regions, and issued 56 technical guidance documents. The GHWP strategic framework towards 2026 is making steady progress. TC indicates outstanding performance, and the new work group has been established as expected, and stepped up the compilation and the review for technical guidance documents. April 2024 witnessed the success of the first thematic exhibition and the innovative medical device symposium held by GHWP in collaboration with the China International Medical Equipment Fair, with participants from Tanzania, South Asia, Singapore, Malaysia, Vietnam, Thailand, South Korea, and China, making exchanges about their regulatory policies on innovative medical devices. Our first training academy had the first on-site training successfully with expert reviewers from the European Union, South Korea, Saudi Arabia, Indonesia, Malaysia, and other countries and regions, lecturing about their regulatory system for medical device. Furthermore, we had developed strong ties with other international organizations, such as the WHO, AMDF, and AMDF, African Medical Device Forum. GHWP is the big family that is open, inclusive, united, and enterprising. Building a shared future has always been our faith. The GHW leadership showed us their primary tasks. First, to enhance internal cohesion and strengthen institutional improvement of GHWP, as well as encourage regulatory authority and the industry to participate more in GHW work and make a great contribution to global medical device regulatory reliance. Secondly, to expand global influence of GHWP. Let the world hear the voice of GHWP and promote global regulatory and innovative industry development with excellent achievements. Thirdly, to foster the creativity of GHWP. At present, as the new round of scientific and technology revolution and industry transformation is gaining momentum. Multiple breakthroughs are being made all around the world, and profound changes are being triggered in the medical device industry. Therefore, it's absolutely imperative that all GHW member countries and the region accelerate regulatory capacity building to contribute to the regulatory reliance and the industry upgrading. global harmonization is irresistible trend of development. GHWP leadership is willing to work together with you all to promote the globalization of medical device regulation and extensive consolidation and joint contribution for shared benefit among the member country and the region, so as to make more safe and effective medical device benefit wide public and improve the well-being of the people all over the world. To meet the public expectation for health, all elites from the regulatory and the industry should work together, adhering to the principle of openness, collaboration, steadiness, and win-win to accelerate the formulation and application of technical guidance documents, improve the training of regulatory capacity, expedite the transformation and application of new technology, and with a more optimistic attitude and more fruitful achievement to promote the convergence, harmonization, and reliance the medical device regulation to safeguard public health worldwide. We cherish the culture of diversity and harmony of Indonesia. With the meeting a great success. Thank you very much.
Once again, ladies and gentlemen, please give applause to Dr. Sujinga. Thank you for your speech. Ladies and gentlemen, we will hear the next speech from the Vice Minister of Health, Mr. Dante Saksono Harbuwono. Without any further ado, ladies and gentlemen, please welcome the Vice Minister of Health.
Distinguished guests, esteemed colleagues, ladies and gentlemen. It is my honor to welcome you all to this critical and herbal harmonization working party and technical committee leaders meeting 2024 in Bali. I would like to take your attention to Bali people famous philosophy called Tri Hirta Karana, which is simply translated as three causes of well-being or three reasons for prosperity. Holding this philosophy, Balinese people believe that to gain a happy life, they have to live harmony with God, harmony among people, and in harmony with nature. This is truly relevant with our meeting today, where great minds and hearts are gathered. In coming 2 days, I hope by engaging of full exchange of idea and knowledge will make collectively envisions a bright future, a harmony on regulation fostering innovative development in global health. Ladies and gentlemen, we realize the importance of innovation in transforming the healthcare sector. We are embracing cutting-edge technology such as telemedicine, artificial intelligence, and digital health solutions to bridge geographical barriers and improve service delivery. To make this possible, we are working to establish an ecosystem that fosters innovation and collaboration. This is essential to align the national health industry and services with international standard and regulation at global level. The emphasis on domestic industry and international healthcare staff engagement in this statute represents a significant step toward a self-sufficient and globally competitive healthcare sector. Ladies and gentlemen, I'd like to underline that our common mission within the GHWP is to create regulatory convergence toward international best practice for medical devices. By harmonizing our regulation, we can speed up approval process, lower barriers, and ensure that our regulation frameworks meet international standards. This will improve not only quality and safety of medical devices, but also increasing patient access to these essential products. Let us work together, hand in hand, to demonstrate our commitment to improving healthcare and ensuring all patients have access to the most advanced medical technology. By enhancing solutions and bridging gaps, we can create a more innovative and accessible healthcare system to all and ultimate a harmonized life for a man to life like this Triharta Kirana. Thank you very much.
Please give applause, ladies and gentlemen. That was the speech from the Vice Minister of Health, Mr. Dante Saxono Harbuwono. Like he said before, in Bali, we believe about Trihita Karana. It means about the balancing life relationship between human with God, human with human, and also human with nature. And we do hope from this moment we can find in harmony, especially in health industry. So, ladies and gentlemen, as a sign of the opening of the GHWP 2024, we kindly ask the name that I have mentioned to press the sign button that has been prepared. So we would like to invite to come to the stage Director of Pharmaceutical and Medical Devices Resilience, Mr. Roy Himawan. Please come to the stage. And also we would like to invite GHWP Chair, Dr. Sujing He. Chairman of Gakeslab, Mr. Raden Kartono Dwijo Suwoyo. Director of Medical Devices Production and Distribution, Mr. Dede Mulyadi. Director of Medical Device Control, Mrs. Eka Purnamasari. Last but not least, we would like to invite GHWP TC Chair, Dr. Abdul Latif Al-Wadman. Just for your information, ladies and gentlemen, if you want to record this special moment, please do prepare your phone for this memorable moment on my count. And of course, I need all of you to help me to count it together starting from 3, 2, 1. Okay? Could you please help me to count down together? All right, Mr. and Mrs., ladies and gentlemen, are you ready? Everyone's so excited, and now let's count it together starting from 3, 2, 1. Please give applause, ladies and gentlemen. And finally, Global Harmonization Working Party TC Leaders Meeting 2024 and Capacity Building Excellence in Medical Device Regulations and Innovation is officially open. Wow! What a beautiful morning. And now, it's our time to take a picture together. So, ladies and gentlemen, Mr. and Mrs., we would like to invite you to move to the center and let's take a picture together. And after that, we are moving to the downstairs and let's take a picture with all of the participants. Alright? On my count, when I say 1, 2, 3, could you please say Bali for your wildest smile? Alright? Photographer ready? 3, 2, 1, say Bali! Wow! Beautiful smile. Alright, so I would like to invite all of you to please move to the downstairs and take a picture together with all of the participants. And I would like to all of you, all the participants, ladies and gentlemen, could you please stand up and show me your best smile for this morning. Alright, and now, once again, ladies and gentlemen, when I say 3, 2, 1, please say Bali. Alright, photographer ready? Alright, let's start round. Oh. Ready? Everyone's ready? 3, 2, 1, say Bali! Oh, that's so nice. Once again, 3, 2, 1, say Bali! Alright, please give a round of applause once again to all of us here. Thank you for your spirit. You can back to your seat, ladies and gentlemen. And thus the GHWP 2024 activities has been inaugurated. And thank you to the delegation from the Ministry of Health of the Republic Indonesia, all the honorable guests, and all ladies and gentlemen. And may this event from 12 to 13 of June 2024 at Pullman Legian Beach Hotel Bali run well and smoothly. And next, we invite the audience to enjoy the coffee break that has been prepared at foyer area. So you have 15 minutes to take a break before we back again to this place. So we have some agendas for today. So ladies and gentlemen, once again, please enjoy your coffee break. See you on the next 15 minutes. 5 minutes. So I would like to invite all of you to please back to your seat because we will start the next agenda on 5 minutes. Thank you. Ladies and gentlemen, welcome back to Legian Ballroom, Pullman, Legian Beach Hotel, Bali. And I hope you enjoy the coffee break because we will start the next agenda. Ladies and gentlemen, let's start with the next agenda. The next event is the TC Open Meeting, which will be filled with presentations from each chair of representative of the GHWP working groups. For the first presentation is an update from the CO chair of Work Group 1, Pre-Market Submission and CSDT, which will be presented by Ms. Mandy Kim. So ladies and gentlemen, without any further ado, please welcome Ms. Mandy Kim.
Good morning, everyone. My name is Mandy Kim, Working Group 1 co-chair from J&J MedTech. Yeah, I will update GHWP Working Group 1 on behalf of Working Group 1 Chair Dr. Park, MFDS, couldn't join today. So first, I'm really grateful to meet you in beautiful Bali. Today morning, I could see the really beautiful sun rising. So it's good today and tomorrow. Working Group 1 is related to pre-market submission and for medical devices. This is the current Working Group 1 membership status. We have a total 47 members from 13 countries, composed 10 regulators and 37 industries. Working Group 1 activities are as follows. Working Group 1 has bi-monthly regular meetings virtually, and we try to hold face-to-face pre-market related working groups, Working Group 1, 2, 3, annual joint workshop separately. This year also, we are planning the joint workshop in Taipei in August. So through the joint workshop, yearly work item sharing each other, and the deep dive into the work in progress and document draft review. And also one of our key working item is guidance development part, so with both sides, regulators and industries. So we compose the document drafting committee and have separate meetings with each working item. This is our ongoing working item and plan. We are now almost finalizing to revise the GHWP change-related document with Working Group 2 and 3. It has been co-worked since last year, led by Working Group 2. This year, Working Group 1 also started a new work item to revise the guidance document for combination products. The new work item proposal was approved by TC, and drafting committee is working now, already committed. Although not started yet, we are planning to develop a survey questionnaire for the white paper on good reliance practices. This is our work progress, the details of the work item in progress. The guidance of the combination product was initially developed in 2016. The contents were quite general, from definition and high-level decision criteria of the primary mode of action and into post-management as well. After almost 10 years, we would revise it by reflecting the current diverse combination product category and trends. So we are developing a survey questionnaire to understand each market's latest related guidance and jurisdictions, and find out good review practice for combination products. now is very initial discussion stage. So we are targeting the completion of the revision in 2024 or 2025, depending on the scope of one-time revision or step-by-step phasing revision. Working Group 1 is planning the capacity. Yeah, this is Working Group 1 capacity building training plan. So Working Group 1, the fixed topic is first half of this year is EIFU related online session. Industry representative will have the online open session on 27th June this month. And second training is planned for change management, additionally, change management part, and then additionally suggested about combination products guidance and review part for training. The topic and schedule will be updated on the GHWP website. In the final, we are assessing and revisiting the developed document led or joined by Working Group 1. GHWP TC leadership is encouraging regular reviews and updates to ensure document effectiveness. So Working Group 1 is open to all the documents and reviewing and assessing. So we have some jurisdictions how to maintain, how to obsolete, or how to revise current documents and new documents development and revision part as well. Working Group 1 is open to everyone. Please continue to pay attention to Working Group 1. Thank you.
Thank you to Ms. Melly Kim for your presentation. For the next presentation is an update from the chair of Work Group 2, Pre-Market IVDD, which will be presented by Dr. Wenwei Sai. Please welcome Dr. Wenwei Sai.
Hello everyone. Before my presentation, I would like to say to Indonesia friends, apa kabar? My name is Wenwei Cai. My name is Wenwei Cai, current Working Group 2 chair for pre-market IVD. And my working group co-chair is Dr. Adele Hay Schneider. And my advisor is Ms. Jelly Tan, retired from TGA Australia. Okay. And this is the current status of our Working Group 2. And our currently, we have 44 members from 19 economies, and including one advisor and one observer. And one new application in progress, Dr. Sungjin Park from MFDS Korea. And we plan to have at least 3 main meetings in 2024. The first one is a Working Group 2 kickoff meeting in February, and the second one is Working Group 1, 2, and 3 joint meeting, online joint meeting for change management to register medical devices in April. And the third one, we would like to host a meeting, same as a joint meeting in August in Taiwan. And the following slides, including our Working Group 2 achievements and the current status, I would like to invite my co-chair to introduce the following slides. Dr. Adele Hay.
Thanks, Wenwei, for the introduction. And I would like to share a little bit about what we are doing in Working Group 2 IVD. And I give you an introduction to the IVD pre-market regulatory framework. As you can see, where we work on, starting with definition, then classification, conformity assessment, clinical evidence, submission requirement, additional consideration, and more, that we are working on. First, you can see we have a guideline on the definition of medical device and also a medical device in vitro diagnostics. Then we have a guideline on classification of IVD because such is different from the MD definition. And we have also worked and provide you guidance on conformity assessment such as essential principles, so guidance how to do and how to approve the essential principle of safety and performance. Then we have role of standards in the assessment of medical devices and the principle of conformity assessments for in vitro diagnostics. A very important part is the clinical evidence. So what we also provide is a guidance on clinical evidence of IVD medical devices and the clinical performance studies. Then, regarding submission requirements, we provide a guidance, or we worked on a guidance on submission dossier for demonstrating conformity to the essential principles and of safety and performance, especially for IVDs. We have guidance on labeling of IVDs and also on regulatory requirements for EIFUs. And sure, we have additional guidance if it's very specific, such we provide guidance on companion diagnostics. And what we are working on currently, we are working, and Mandy already mentioned, hard on the change management to registered medical devices. It will be really a guidance which gives really a fit-for-purpose change management and getting into details also changes for new innovative devices such as software as medical devices or AI. And there was a commenting process last year already, and we got quite a lot of comment, which is really good. So we get a lot of insights from over the world, and we will implement this guidance, and so we are working hard on it and revise the document and hope we can endorse this new guidance or the update of the guidance by end of the year. Then what we also will do, we work with Working Group 1, and you heard it from Mandy, on the guidance on regulatory practice for combination products. We also started the project on duplication evaluation. We wanted to look into what other guidelines international exist and what do we have in GHWP, and do an evaluation what is the same, identical, or what is different from GHWP. And finally, we are also providing to all of you training on replacement reagent and instrument family policy, which is also for changes specific for IVDs. And you know, if you have new instrument, additional instruments, and how you do a change management and not to have to approve each test on this new platform. So also very innovative progress. So that's for today, it's all. Thank you for attention. And we are all happy if somebody would like to join and support us in IVD Working Group 2. We are happy to welcome you. Thank you.
Thank you so much, and that was an update from the Chair of Work Group 2. And now we'll move on to the next topic. The next presentation is an update from the Chair of Work Group 3, Pre-Market Software as Medical Device, which will be presented by Mr. Chun Yen Qian. Please welcome Mr. Chun Yen Qian.
Mr. Roy, the Ministry of Health Indonesia colleague, and the GHWP Dr. Latif, and the GHWP colleague, and all Indonesia friends. Good morning. I'm CJ Jen from TFDA. and current working group 3 chair. This working group 3 is working on the AI, SAMD, and cybersecurity related issue. If the industry from Indonesia has interest in this topic, maybe you can join working group 3 and let's move on to make contribution to the harmonization of SAMD regulation. So now, current working group 3 co-chair, Tony, is very experienced in this field. Maybe, I believe he been co-chair maybe for more than 10 years. And now I will, about the working group 3 update, I will leave it to our co-chair, Tony. Tony, please.
Good morning, everyone. Good morning, directors and representatives of Ministry of Health Indonesia, Chair of Association of Medical Device of Indonesia, and GHWP Chair, Co-Chair, TC Chair, and TC Co-Chair, and everyone. Thank you for coming here, Bali, paradise. So I would like to give a short updates on our work, what we have done in the past for our working group and also to the industry. So just to give you some of the quick status on our members. So with the help of our chair and also our and also with many of you supporting, we have a big increase of the members. And now we have 48 members from 11 economy compared to a few years ago. We just have, I think, half of it. So it's a big increase. So with the new addition of the members, now we can have more resources to develop more documents, which is hopefully in the future can help not just for regulators, but also for the industry to catch up the latest development on the software as a medical device. So now we have 40 members from regulatory authority and 33 members from industry. So GHWP is the only platform that allows not just regulator, but also industry to participate. So it's also very important for us to be part of it, not just to, to contribute to the industry. Sharing our force and also helping our chairs, our industry regulators to learn and also helping them to develop something for them, for their own jurisdiction. So for 2024, so we have some work has been done. So we have some. So we in the early of this year, we already have the kickoff meeting for 2024, and we do have few online meetings through Teams. So now working at home is kind of a practice for everyone, I would say. So meeting is more easier nowadays as well. So we have more and more meetings through online platform, through Zoom or Teams and all the ways that we can do. And in the coming, but it doesn't mean that we can avoid the meetings face-to-face. So it's just like the meeting now. And also we are also trying to, we will be in one of the face-to-face meeting jointly with Working Group 1 and Working Group 2. We will have some more participants from Working Group 3 starting from last year. So we this year we're also expecting have more members joining this face-to-face meeting. So it is a meeting that we can be very efficient to develop the guidance. So we are locking in the room, to develop the guidance. So no emails, no phone calls, so just focus on the guidance document. So because when we're developing guidance document or maybe white paper or maybe survey, that kind of activities, normally we was just sending out the draft document and 1 month later, 2 months later, we're coming back with few, feedback, and then we make the revision. So the time is very lengthy. So in order to improve the efficiency, so this kind of face-to-face meeting is very important for us to develop some very advanced guidance. And also with the group leadership, like Dr. Adi, so Yeah, so hi, so you working on the change management, which is impacting and helping the industry a lot to making a very good documents for the whole medical device industry. So thank you for that. And also, we will also have the annual meeting later this year, Malaysia in person. So hopefully we will all see all of you in the Malaysia annual meeting as well. So it should be very close from here in Indonesia. So when we talk about software as a medical device, 10 years ago it's a very advanced topic. So now, I think nowadays, 10 years later, it's not that advanced sometimes, what we say. But it still have a lack of reference sometimes. So that's why when we're developing guidance, we normally refer to some international practice or maybe international guidances. But when the international standard or guidances is not available, so we were trying to making some grounds to making the guidance document to be more reliable. So that's why sometimes we're creating some white paper, do some do some regulatory research, and then making it as a backbone for the future guidance. So that's why in our working plan, we do have some white paper to do some comparison. Actually, it's a very informative document and very good for everyone to have a few minutes reading, then you will have an understanding how different jurisdiction is regulating the software or in particular topics. So as usual, we will have some continuing some development project which is already approved by TC. We will have the pre-market requirement for artificial intelligence, machine learning-based computer-aided detection, and computer-aided diagnosis software as a medical device, quite an advanced topic. And we're trying to, so we follow the GHWP 4-step approach to develop the document, and we'll have the review process, we'll have the commenting process, or everybody can have the chance to participate. So now it's in the step one, first step to have the draft document, and then for further circulation for public consultation. And the second document is the guidance document on qualification and medical device software. So this is actually a document that we have prepared in the past. So we make a revision and trying to keep up to date, and also trying to making it more current, because the previous version is based on the GHWP, which is the old version. So we're trying to be keep it up to date as per required. And also some white paper. So as mentioned, that's the backbone for the guidance document. So we have the comparison for requirements from different jurisdictions. The list is getting longer and longer. When we first developing the white paper, we just focus on few key jurisdictions, but we receive a lot of feedback and trying to include more and more jurisdictions in the comparison. Ultimately, it's a big table. So comparing what is the requirement to for the pre-market submission for the CMD. So it's getting bigger and bigger. So we're trying to get this white paper to be released as soon as possible. Of course, the content has also to be reliable as well. And also the cybersecurity, so has been talking for years, but now we come up with the white paper and also the guidance document, and it's also under the review process, because after the COVID, lots of things has been changed. So we also need to cater the new requirements from the different jurisdictions. So now it's also in the review process and should be released soon when the draft is available. And also we are not alone. So we closely working with different working groups. So with working group 1, working group 2, and also with working group 5, and we're expecting there will be more to have the joint guidance, because software as a medical device is just a topic. I mean, it's a category of the device. So it has to be worked with different areas as well. So there will be more and more documents to be jointly working with different working groups. So I'm not going through in the detail as previously mentioned. So we will also have some new proposals. So as I mentioned, we have new resources, and we're expecting some of you can join us as well. to participate in some of our new working items, very advanced topic. So say, for example, we review and update some existing document on the risk categorization, and also we will have the joining with the, trying to initiate some new resources to join the review the guidance document on regulatory practice for combination products. And also the AI ML-based CMD change submission requirement. So this is also a new one. So we hope everyone who interested to this topic coming to join us. So 10 years. So it's not a very long, but it's also not very short. So we have been moved from qualification. We have, at first beginning, we know nothing. And also IMDRF also have nothing at that time. So we try to do something as requested by the TC chair and also the GHWP leadership. We start with some qualification document, risk categorization document. And since 2019, AI become a hot topic and also impacting some of our work. And we also need to taking them into consideration. So now we are moving to pre-market submission requirement, change management, and also the cybersecurity. And we don't know in the future, but maybe digital health or maybe AI ML could be one of the topics that we are going to focus as well. So we need more people, we need more experts to join us. Thank you.
Once again, thank you so much, Mr. Chun Jianqian and also Mr. Tony. And now we'll move on to the fourth presentation, which is an update from the Chair of Work Group 4. Post-market will be presented by Dr. Ambrose Wong. Ladies and gentlemen, please welcome Dr. Ambrose Wong.
Good morning, Mr. Roy and GHWP TC Chair Dr. Latif and friends from Indonesia, colleagues from GHWP. I'm always excited whenever I came to the TC meeting or any meeting because I can see all the happy faces here. And today I'm going to have a very brief introduction about Workgroup 4. And first of all, I would like to start by introducing myself. I'm Dr. Ambrose Wong from Hong Kong, China, Department of Health. And our co-chair is Ms. Kitty Mao from GE Healthcare Singapore. And we have a new advisor, Professor Gao Pei, who is an expert in the field of post-market in Peking University. I think, but anyway, this is not the PowerPoint that I intend to use today, but anyway, I can still present it. I intended to use it in the closed meeting, but anyway, I can skip those slides that I don't need to present here right now. And first of all, I would like to update about Workgroup 4 progress. And this slide summarizes what are we now. So as I've mentioned previously, I am the current chair, Dr. Ambrose Wong, and our co-chair is Ms. Kitty Mao, and advisors, Professor Gao Pei. And currently, we have 22 members, and 10 from the regulatory authorities, and 12 from the industry. So similar to previous work group, we need more people, and hopefully after the presentation today, you have the interest to join us. And for the meeting since the term started in 2023, we have in total 6 virtual meetings. And I intend to show a happy face with the Zoom pictures here, but it's not available in this slide. But anyway, and for Workgroup 4, we have maintaining 8 guidance documents related to, first of all, the Post-Market Resource Center, that is the PMRC, which is a one-stop platform intended to allow our members to have one platform having the information about the regulatory guidance or information around the world, so that we intended to provide the convenient means for our members to access to the information they need. We will update that webpage twice a year. So the last update has been done in June, like 2 weeks ago. So if you're interested, you may go to our website and check it out. And for the other work documents, in this year, in 2024, we are going to update 3 documents. related to adverse events. So we have adverse event documents, including the application forms, and the one very specific topic about adverse event is the percutaneous coronary intervention devices guidance document, adverse events document. And in the coming year, by 2025, we are planning to update the rest of the documents, including ones about field safety, corrective actions, and the rest it's about one of the system that is called SAT, is a Safety Alert Dissemination System, which aim to provide a means for our GHWP member to share the safety alert information among ourselves so that we can act promptly. So for the studies, we also conduct study under Work Group 4. Last year, we just completed a adverse event terminology surveys among our members to know about the situations, what they are having right now, about the adverse event terminology and what they need in terms of training. There's quite a lot of useful information we gather to put our way forward to what we are going to do in the future to help in this area. And in the coming year, we are going to conduct a survey about the system I have just mentioned, the Safety Alert Dissemination System, in order to trying to review the effectiveness and suggesting way forward how we can improve further the effectiveness of the system. Next. All right. I think we have skipped. This is not. Yes. And I would just briefly mention about this because we are going to suggest to the TC for approval today. And Work Group 4 is constantly thinking of some new ideas, how to improve our industry or our authority, regulatory authorities, and how to improve the post-market the issues. So we are constantly thinking of some new working items. We are now thinking about to write documents related to the active post-market surveillance system. So just stay tuned with us. If you have something more, then we will put up on the website so that you can have a look and then get some more information about that. So as Work Group 1 has mentioned as well, we are actively reviewing our document under our work group. As I've mentioned, we have 8 guidance documents right now, and we are planning to revise or review all of them by 2025, and some of them may be revised and some of them may be updated. So we are planning to have it done by 2025. So lastly, I would like to appeal to friends from Indonesia or everywhere in the world. If you are interested in the post-market, interested in bringing up harmonizations among post-market, just email me or just fill in a form and join us. We are more than welcome, all of you. Thank you.
Thank you so much, Dr. Ambrose Wong, for your presentation. For the next presentation, ladies and gentlemen, is an update from the Chair of Work Group 5, Clinical Evidence for Performance and Safety, which will be presented by Dr. Muhammad Majrashi. So now, ladies and gentlemen, please welcome Dr. Muhammad Majrashi.
Good morning, everyone. I'm happy today to present on behalf of Work Group 5. First of all, I would like to thank the Indonesian country for the hospitality and actually enjoying the 2 days today. So I would like to also thank the GHWP leadership, GHWP chair, TC chair, co-chairs, and all of the participants today to discuss and just only transparent ideas about the current progress for the Work Group 5 and getting the feedback in this work. So for the Work Group 5, actually the Work Group 5 is focusing on the clinical evidences for performance and safety. I will just give a brief explanation about the performance and safety, which is very important in medical devices, either in pre-market phase or post-market stage. So we serve both work groups, either in pre-market or post-market. So we try to get clinical evidence and try to get the benchmarking and developing new guidance or updating the guidance in the scope of the new era of digital health and the new challenging in medical devices. So just a brief, my name is Mohammed Majrashi. I'm working with Saudi FDA as an executive director for surveillance and biometrics. And my co-chair for the group, Mrs. Yang Ting, she is here today, and actually our secretary is Mrs. Mai. So the total number of the work group 5 members, we have 18 members, 10 from the regulatory and 8 from industry, and we are looking for getting more participants in this work group. Actually, it's a very interesting working group. As I say, it is no promotion, but actually it's very important. You know, the clinical evidences and the clinical evaluation of the medical devices is most important for the industry and for the regulatory perspective in order to ensure the clinical assessment for the medical devices, which is used in diagnosis, treatment, and the prevention for the diseases for all of the patient. So for our advisor also, Shirley Thanks and Martin David. The current work group that we are focusing on to determine the gap analysis for the post-market clinical form. So we're studying the gap analysis conducting for the post-market clinical follow-up studies between different perspectives from the IMDRF and actually another ISO and another organizations. So the next step in our working group 5, it will include the working group 5 updating in the post-market clinical follow-up, and we'll keep updating. Actually, it's very important to keep harmonized and convergence for the terminologies in clinical assessment and clinical evaluations for all of the jurisdictions and for all of the countries. Also, the gap analysis conducted for the clinical evidence for the medical devices and IVD, the key definitions for the IVD clinical assessment, which is very important. Actually, we are working in that area, and also the following documents are used to study the gap analysis from the IMDRF and GHWP for the clinical evidence, clinical evaluation, IMDRF documents, and also guidance of the general principle for the clinical evidence for IVD. Our next step in this work in progress is to updating the guidance with more information about the clinical evidence for the medical devices, focusing on the performance and definitions, and focusing on the clinical assessment. It's exactly because actually we found it a synchronization between different jurisdictions and the different organizations. Also, we are focusing on building the capacity for the people in terms of the clinical evidence and the clinical evaluation. We will have like semi-training or seminars training will be conducted by officially on 18th of July. For all of the participants here in this group and from the GHWP members, and also for the public to give more insight and more insight about the clinical evaluations and systematic review and the meta-analysis for the IVD performance, and actually which is most important, as I said earlier, to determine exactly how can we go further in clinical evaluations and how can we assess the clinical assessment tools for any medical devices. So thank you.
Once again, thank you, Mr. Muhammad Majrashi, for your presentation. Ladies and gentlemen, now we are moving to the next presentation. Is an update from the co-chair of Work Group 7 about quality management system, which will be presented by Mr. Lee Ibin. So ladies and gentlemen, please welcome Mr. Lee Ibin.
Selamat pagi, can everybody hear me? Yes. Thank you very much. I'm very happy to be back in Bali after 13 years. Oh my God. So that was 2011. I still remember I was in my ex-company and we sponsored the annual meeting for GHWP at that point in time. And actually, that was also the time I became the co-chair of this working group. So it's been 13 years. I'm still standing here. It's a bit strange. Okay, anyway, this is our working group update, right? And you would see that just now it was working group 5 and suddenly now becomes 7. The reason for this is because last year, working group 6 and 7 merged to become quality management system. So that's why you see a skip in numbers, all right? Our chair is Mrs. Chen Yan. Is she around? Is Chen Yan around? No, but I know our advisors are around. Yes, Peter, can you stand up? All right, Peter Linders and Asai-san, can you please stand up? Yes. Okay, the reason why I asked them to stand up was because I think some of the local industry players may not know them, so it's a very good opportunity to see their faces and to interact with them afterwards, right? So Peter is also my ex-colleague, right, a long time ago. And I mean, besides all this fun and games that you may get to experience when you speak to him, he was the previous TC 210 convener, right, which is actually the one that governs our ISO 13485 and all that, right? Asai-san, right, is an industry leader in Japan, and he has been involved with the GHWP and HWP for many, many, many years, right? And now Japan is actually part of the member countries. I think we are very glad to have Asai-san's continued support as well. He continues to be one of our liaison persons for RMDRF, for TC210, together with myself, right, to advance all things quality management system. Right. Should I talk about myself? Nah, just leave it. Okay, next slide, please. Does this work? Does this work? Does this work? Okay, it works. Okay, it works. It works. It works. Oh no, I'm finished. Too fast. How do I get it started again? Okay, okay. Wait, move. Move, okay. Yeah, this is the second slide. Thank you very much. Okay. Hey, why did you jump again? Come on. Okay, thank you. Okay, so we have now 47 members, right? This is because we have merged the two groups together, right? And we are trying our best to get all this sorted out. And at the same time, we are also recruiting new members, right? I think as far as Indonesia is concerned, right, you must understand that this is not just for manufacturers. The QMS that we are trying to advance over here is both for manufacturers and distributors, importers, authorized representatives. So we are also welcoming members from Indonesia and from the ASEAN region because you import many, many devices and many of your regulatory frameworks already have some kind of good distribution practice, right, which you will learn a bit more, okay? So next slide. Come on, move, yes. We have some trainings that has been going on, right? So the first one that we managed to record, and you actually could find it in GHWP website, is done by Asai-san, right, which was last month. And my turn is next. I don't know the date yet, right? So I'm going to talk about risk-based approach to the quality management system as applied to ISO 13485, right? There will be some further trainings. I believe they're all going to be online and going to be recorded, right? There will be on QMS implementation, maybe some practical aspects to talk about, and the audit lifecycle management, right? So we hope to complete this by the end of this calendar year. Okay, this slide is fairly busy, right? And I don't know why there's it's busier than usual. Why is this busier than usual? Okay, let me try to move the slide backwards and forwards. It's still as busy as usual. Okay, doesn't matter. The first 7 actually is the most important because those are all our release documents. Okay? I want to get up. Okay. you could see that the guidance document started from 2013. So actually this group has been writing guidance documents since that time. And the next one, which is the one for 2014, Guidance on Medical Device Quality Management System Requirement of the Distributors, that was the first guidance document that was written from scratch by GHWP, right? Because prior to this, right, we have been working very closely with the GHTF, Global Harmonization Task Force, right, and the IMDRF in terms of guidance documents adoption. But now we have grown a little bit more mature, so we started to write our own. Therefore, since 2014, we've been starting to draft guidance documents from scratch, right? Then in tandem with this guidance document, there's a distributor audit checklist, right? And after which then we have all these other auditing documents which are usually previously from Working Group 6, right, which have merged together, right? The part that is really, really busy, right, I'm sorry about that, but below that you will see the guidance document for risk-based approach, which is something, again, something written by us, right? Following that, we have about 4 different draft documents that we are planning to release in the next 6 to 9 months, right? And they span from sterilization, contract manufacturing, and product localization. So some things which are connected to quality management system, but in all different aspects, so that you will feel a bit more guided. I still don't understand why this is this way. Okay, no problem. Okay, these two are the ones that we are going to table, I think, this meeting, or if not, the annual meeting at the end of the year. These 2 new working item proposals, right, you will see that there's a comparative study. Actually, we already have a comparative study ongoing. This is just a revision of this comparative study to add more details, because we all had received feedback that there's more salient details with regards to the aspects of quality management system as far as the comparison between countries, because there are several multinationals that are getting very confused with this, right? So we decided to actually update this document, right? The next one is on sterilized and implantable medical device, on how to deal with the QC side of things. So quality control is not something that's it's very sexy, right? It's just pass, fail, yes, no, okay, reject this, let me go rework this. But sometimes I think manufacturers also lack some guidance as far as this is concerned, so we decided to try to write something along these lines too. Actually, that's all I have. But to end off, right, there's actually 2 other points I'd like to mention. We have been also working together with IMDRF, right? So IMDRF has certain initiatives where they are working together with GHWP. So one of them is actually supplier management, right? Because as you know, many manufacturers will have issues with trying to deal with supply controls, supply communication, what is a supplier for that matter, right? So we are working along those lines. We've also been tasked by the GHWP leadership to try to recommend a couple of our guidance documents in which we're trying to push for adoption GHWP-wide. So this is, again, something that we tried to do in the past as a working group, and we weren't very successful, but maybe with the help of the leadership, maybe we can push this forward. Okay? So that's really all for me today. Thank you very much, and also very happy to see some familiar faces again after 13 years.
Please give applause once again, ladies and gentlemen. That was the presentation from Group 7 about quality management system. And thank you, Mr. Lee Ibin, who makes this session more relaxed, of course, with his humor style. And next, we are going to the next presentation. Is an update from the Secretary of Work Group 8, Standard, which will be presented by Mr. Muhammad Marwan bin Anur. So once again, ladies and gentlemen, please welcome Mr. Muhammad Marwan bin Anur.
The Honorables, Mr. Didi Mohyadi, Director for Productions and Distributions of Medical Devices, the Honorables, Ms. Eka Purnamasari, Director for Medical Device Controls, the Honorables, Mr. Kartono, Gakes Lab Indonesia Chairs, the Honorables, Dr. Abdul Latif as GHWP TC Chairs. So, good morning everyone and Assalamualaikum. It is a great pleasure to be here in this GHWP TC's meeting. So, before that, I would like to thank to the GHWP team and also the MOH Indonesia for organizing and hosting these great events. So, today's, can you share the screen? Okay, so today's I would like to share some updates and also the significant contributions or also efforts from GHWP WGA on the Standards Committee. So as you can see on the screen, this is the current positions under the GHWP WGA committee. This committee was led by Madam Salbiah Yaakob from Medical Device Authority Malaysia. However, unfortunately, she cannot join us today due to her health conditions. So alongside, we have Mr. Tony as our co-chair, and TC advisor is Mr. Gert Boss, and I'm the secretary of GHWP WGA. So this committee of our scope of works, there are three main objectives. The first one is the preparations of documents relating to the compliance with EPSP, Essential Principles, Safety and Performance, using the recognized standard. The second one is the reviews and provide recommendations on the standards for harmonizations. The last but not least, we have the monitors and participate in the international standards bodies like ISO, IEC, relating to the medical devices. So as you can see on the right screen, this is the compositions of membership under the GHWP WGA. We have 6 members from cooperative and observer. We have regulatory authority, there are 8, and we have 40 members from industry. Total, we have 28 members from various countries. So if there are any experts in this room and would like to join this GHWP WGA committee, you can scan this QR code and apply and submit to the GHWP TC Secretariat for the applications. So I'll leave it around 10 seconds. So quickly take out your phone and scan. Okay. So I move to the next slide. This is our work plans from 2024 to 2028. This we have discussed during our first meeting this year to come out on the work plans from 2024 to 2028 to 2026, 3 years. So we agree there are 8 work plans to be done by these terms. So the first one is documents on the code of practice for good engineering maintenance management of medical devices. So basically, these documents on the scope of this document is related to the how the maintenance management of medical equipment under supervision of healthcare delivery organizations. So we already submit to new work item to ISO committee, ISO TC 210. So now has been approved, and currently the status of this draft technical standard was at the stage of 40.00 draft stage of the technical specifications. So we move to the second work plans, which is on the collecting a list of the standard used for medical device regulatory purpose that are recognized by the GHWP members countries. So since the existing of the standard is quite dynamic, and we are each of the country need to maintain the list of the standard itself. So we are recommend to have this final list of the standards which aims to have the repository data for the recognized standard among the GHWP membership. So the current status of this work plan is we are in preparations for all GHWP to provide their feedbacks on the list of the standards. So the third is the working relationship with the ISO TC 210. ISO TC 210 is an importance committee at the internationals related to the medical device and also the standard itself. Like ISO TC 210 also has developed a lot of horizontal standards such as ISO 3485, quality management system for medical devices, and also we have the ISO 14971 on the risk management for the medical devices, and a lot of horizontal standard has been developed by GHWP TC 210. This is important why we need to have collaborations also, or to be a part of liaison representative in this committee. So the current liaison representative is Madam Sabiah Yaakob, and our next next ISO TC 210 meeting will be held next year, early 2025 at Japan. Next, we move to the work item relationship with the IEC TC 62 on the medical equipment system and also the software. So this is basically on the active medical devices. So our current liaison representative is Engineer Abdullah Muhammad Al-Ghurabi. He will report every singles of plenary meeting of IEC. So our next IEC TC 62 will be held on 23rd to 25th October 2024 this year in UK. So if you are joining via national standard body in this committee, please join this IEC TC 62. So we move to the next work item, which is the project on the guidance on the validations, process validation for the productions. So we are works together with the IMDRF QMS committee in order to develop the revisions of GHTF SG3 and 99-10, specifically on the obsolete documents on the process validation guidance documents. So as our decisions during the GHWP TC in Shenzhen last year, we are agreed to work together with W7 to submit the comments to IMDRF Quality Management System Committee. So we move to the sixth work item on the roles of a standard in demonstrations of the safety and performance. So basically this project or this guidance document has been published in our website since 2014. So currently we are in revisions of these guidance documents, and now are in drafting stage by led by our project leader, Mr. Asokoma. So next we move to item 7 and item 8, specifically on the guidelines on developments of GHWP documents. We have two parts. The first part is related to the procedure for developments. So basically the process, how we can develop the GHWP document with the standardized and formal procedures. And then the second part is the structure and the drafting, basically on the content of the document itself. So the current status for part 1 in finalizations of GHWP TC to decide the certain matter has been raised. Okay. Next, for part 2 is still in drafting stages under the GHWP WJS. So this is a guidance document assessment. Basically, there are 2 documents has been published under the GHWP website. The first one is GHWP WJA F001 2023, was published last year. And the document is a medical gas system, essential principle of the safety and performance standards for demonstrating compliance. So the scope is like what is standard for the medical gas system that can be complied with the EPSP. So we still remain as it is, and since it was published by last year, 2023. So the second one is AHWP WG2-WGAF002 2014 on guidance document on roles of the standard in the assessments of medical devices. So as I mentioned before, this document has been revised at under the GHWP WG8 committee. I think that's all. Thank you, everyone.
Once again, thank you so much to Mr. Muhammad Marwan bin Anur for your presentation. And now the next presentation is an update from the co-chair of Work Group 9, UDI and Nomenclature, which will be presented by Ms. Liloli. Ladies and gentlemen, please welcome Ms. Liloli.
Good morning, selamat pagi. Okay, so dear leaders, ladies and gentlemen, my name is Liloli, the co-chair of Working Group 9. On behalf of our Working Group 9 chair, on behalf of our Working Group 9 members, I'm very honored to be here and to give you an introduction and update for the UDI and nomenclature. Thank you. So this is today I would like to share with you all. I will introduce the Working Group 9 and the membership, and also will give you an overview of guidance documents so far and what's the next steps. Firstly, let me introduce the history of Working Group 9. In 2008, GHWP established a special task group for UDI and nomenclature. Since then, the special task group has been pushing forward the nomenclature and UDI regional harmonization. In 2017, with the support of GHWP member management team, this special task group officially became the Working Group 9 for UDI and nomenclature regulation harmonization. Up to now, our Working Group 9 has been deeply involved in the fields of UDI and nomenclature for over 15 years, promoting coordination and the harmonization of UDI and nomenclature regulations and policies on behalf of GHWP members. This is, I would like to share with you all so far what our goal and objective, establishment of a communication platform between the regulatory agencies and industry, promote coordinated and harmonized approach of UDI and nomenclature during the development and implementation of related regulations and policies, urge global convergence of medical device UDI and nomenclature regulations on behalf of the GHWP members, and to actively participate in coordination of international harmonization initiatives. To achieve the goal and the objective, members of Working Group 9 have put in great efforts. So next, I will do the introduction of our Working Group 9 membership. So Working Group 9 has a total of 38 members. At the 26th annual meeting held in February last year in Saudi Arabia, Ms. Zhou Wenwen, the Director of Division of Registration Research, Department of Medical Device Registration and NMPA, was elected the Working Group 9 chair. And me from the China industry was elected the co-chair. The secretary of this working group is Dr. Yi Li, a representative of a regulatory authority from China. Among the 38 members, there are 9 regulators representative from China, Saudi Arabia, Thailand, Chinese Taipei, Malaysia, and Oman. Also, we have industry members, total 29. They representative from manufacturing enterprises, industry associations, UDI, service providers, etc. And this is the training we held this year. It's on 4th June. And we have invited the regulators from China, Saudi Arabia to introduce the UDI progress and requirements. And also we invite industry representatives to introduce the UDI progress and requirements for US and EU. And we also invite a person from the national company to share the practice, the experience for us. And this training is an online training, and so we have more than 150 members join us and participate this online training. Next, I will go through with you all the guidance documents of Working Group 9. So far, we issued 3 documents, one for nomenclature, the other 2 for UDI. For the nomenclature, we issued guidance for medical device naming rule in 2015. And for UDI, one is issued in 2019, that is UDI white paper, and the other one is UDI rule that was issued last year. So thank you so much, leaders, to endorse our documents. And firstly, let me introduce the guidance of the naming rule. This guidance consists 2 parts. One is the introduction, and the other is the guidance. So this document, so time to this white paper. UDI white paper is the one of 2 the UDI guidance by Working Group 9. And this white paper, the purpose is to consider the implementation of UDI from the perspective of GHWP to provide a basic framework of GHWP UDI rules development. And this document has a total of 8 chapters, mainly including the international progress and what is UDI, the responsibility, challenges, and the best practice. This UDI rule issued on last year, and this document's purpose is to provide a reference for GHWP members who have not yet issued UDI regulations, assisting them in quickly building a UDI system. And this UDI rule has totally 5 chapters. We have the general provisions, UDI, UDI carrier, UDI database, and some of supplementary provisions. This picture is a kind of overview of UDI implementation. We already issued the UDI white paper, the UDI rule, and so there are 3 key factors if you would like to go implement UDI. That is the creation and the placement of UDI, and to consider about how to do the UDI data elements. So consider of these 3 key elements. That's what we are doing this year. So we are drafting 2 documents. Would like to support or assist the industry and regulators into deeply understand or to support how to implement UDI. Okay, so what's the next step for Working Group 9? Besides what I just mentioned, the 2 documents are under drafting. So these 2 documents, what our timeline or our goal is to, so far we already complete the comments collection within Working Group 9. And next step, we will do some revise with the Working Group 9 members' suggestion, and we'll deliver this version to the GHWP Secretary and open for the industry comments collection. So your comments appreciate and welcome. And besides these documents, we also doing some research and challenges collection. And so for UDI, so we are thinking we already have the key factors documents. So next step we will to think about how could we support the industry and also regulators for the UDI application, like the recall, the traceability, etc. Okay, that's all for my today's introduction. Thank you so much. Terima kasih.
Terima kasih kembali, and thank you so much Miss Liloli for your presentation about UDI nomenclature. And now we're moving to the next presentation. Is an update from STG CERP. Acting chair will be presented by Dr. Shang Xiqing. So without any further ado, ladies and gentlemen, please welcome Dr. Shang Xiqing.
Hello everyone, Dr. Latif, all the TC leaders, good morning, and all the gentlemen and the ladies and gentlemen, good morning. I'm the acting chair of CERP, the Special Task Group, and I'm also the Director of Quality Management Division at CMDE of AMPA in China. I have been working with this division for about 8 years. Before joining quality management, I reviewed 9 active products for about 3 years. I'm looking forward to working with you. It's my honor to be half of Miss Asma and my co-chair and other members of SERP on this presentation. My presentation including 4 parts. Let's move to the first part, definition. The aim of SERP aim to achieve the goal of mutually reliable approval and regulatory reliance by developing standards for medical device product registration review, establishing technical review procedures, and reducing duplicate reviews. And as for the member status, we are new groups. And till now, there are 39 members. They are from different countries like Egypt, Japanese, Korea, UAE, and Singapore. And among these 39 members, 26 from industry and 13 from regulatory authorities. Well, this is not the, I think this is not the right presentation. Okay, I can keep on with this map. This is our planning projects. We divided into 3 stages. The first was developing evaluation standards. And the second is achieving evaluation recognition. And the third is our first goal to the single review. So as we know, medical device is very complicated. It has different size, different risk, and different requests. So what we should do first is to develop product list first. And we have done this work. We have selected middle and low risk products. It's about 5 or 6 products in this list. And as for the technical specification, Indeed, we have general principles about medical device safety and performance, and we have guidance, we have standards. But as for the registration application, we need a detailed request. So that's the reason why we develop technical specifications. And WHO has published 2 documents about, they also called technical specifications. It's our important reference for our work. As for the harmonization mechanisms, there are 2 reasons. We need to adopt the international standards, and that's an important foundation. And the second reason, different countries has different regulations. Maybe they have different requests about the products. So all the difference need to definitely to clear in the technical specification. As for the evaluation recognition, the first step was information sharing. The information including, not limited to, technical specifications of products and a technical evaluation report, post-market report, even evaluation process is all included in this information sharing. It's mainly for the regulator. Only so we can build our trust between the country and the country. Capacity building is the important factor for the consistency of evaluation. And as for evaluation quality management system, we all know evaluation needs stability and repeatability. So quality management is very important. I know this. I'm the director of quality management division. So we have built up our system in China. As there are many forms of evaluation recognition. This is a very important part. I think many of you might be interested in these issues. What is simplified evaluation and what is recognition of real results? I think I need an example. Like 2 countries, if they build up reliance, and if a product was approved in one country, and when it hit to another country, the evaluation time maybe is ordinary, in common is 90 days. And if we set up reliance of regulation recognition, it may need 15 or 20 days. And and if we had built up recognition of review result, and maybe we don't need registration, we just feelings, that's okay. As for the single review, we adopted this from WHO reference, his guidance about reliance. This our final goal. I know, we all know, it's a long way from the first step to the third step, but it's worth a try. It's worth trying. That's all. Thank you. My acting co-chair has some supplement.
Thank you, everyone. Just wanted to thank you and express my gratitude to be part of this event. I'm the co-chair of the STERP group, and as been detailed by Dr. Chicheng about our efforts and our working group activities, I would like to highlight the importance of what we are trying to achieve here, streamlining the review process and achieving work sharing, and as well as the reliance within the GHWP member states. I'm just here to call upon all regulators present to participate in our working group. Should we achieve work sharing and reliance within the GHWP member states, it will be not marked as a milestone, but also it will be a transformation in the medical devices and IVDs field. So if you are interested to be part of this glory journey, please reach out to us to be part of the SERP special task group. Thank you so much.
All right, once again, ladies and gentlemen, that was the presentation from each group, and thank you so much for Dr. Song Siching and also Ms. Asma. Can we give a round of applause once again to all of the speakers who already gave the best presentation? So now, ladies and gentlemen, we have listened together the presentation of updates from all work groups in GHWP, and now it's our time to listen together to the topic related to the theme of the work group. So the next presentation on benchmarking regulation for medical devices will be moderated by Southeast Asia Indonesian member of APACMed, Mrs. Irni Anggraini. So ladies and gentlemen, please welcome Mrs. Irni Anggraini.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Welcome to our first topic. So in this very special occasion, we would like to have a presentation about benchmarking regulation for medical devices, essential principle checklist, how to evaluate essential principle checklist from an outstanding speaker, Dr. Muhammad Majresi. Prior to presentation, please allow me to introduce Dr. Muhammad Majresi. Dr. Muhammad will present on behalf of Dr. Latif. Dr. Muhammad is an executive director of surveillance and biometrics Saudi FDA, and also he has experience more than 19 years in medical devices regulation, and he obtained his PhD in biomedical engineering UK, and also he is currently working as Working Group 5 as chair and member on many international medical devices. So, Dr. Muhammad, please come to the stage. The stage is yours, Dr. Muhammad.
Hello again. I will not be long today. Actually, I know it's 15 minutes, but actually it will be an interesting presentation I'm presenting today. So again, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for all of the attendance today. Thank for the GHWP leadership again and for all of the participants. It will be enjoying before the lunch break about the medical devices topics, which is more important and more interesting. So, okay, so we'll talk today about the essential principles and safety and performance of medical devices and methods for their fulfillment. Okay, so I think it doesn't work, but okay. So our agenda today, we will discuss about the global picture and the framework about landscape and why we have essential principles and medical devices evaluation. what's important for the essential principle for the medical devices information evaluation. So standards application to the essential principles, the structure of the essential principles, and a quick run through looking at concepts and fundamental and pitfalls for the essential principle. Also the essential principles checklist, and finally a summary of the common errors. I would like to ask a question. Is there anyone know about how many essential principles for medical devices? Just give me a number. 15, 16, 20, 40? Okay, we will see. So, as we said, we are not working alone for the medical devices. It's good to have harmonization and convergence between all of the international collaborators in medical devices. So the IMDRF and GHWP are working together in order to harmonize all of the terminology, and for the essential principles, it's really important for the industry side. So there is a document from published by the IMDRF called Essential Principles of Safety and Performance of Medical Devices and IVD medical devices. Also, the requirements, the manufacturer of the medical devices and IVD medical devices are expected to design and manufacture a safe and effective product through the life cycle of the medical device. So we must ensure from the essential principles the safety and the efficacy of the medical devices product. This is the most important things. So the rationale behind that, the essential principles of safety and performance provide a broad, high-level criteria of design, productions throughout the whole life cycle of the medical devices and IVD to ensuring the safety and efficacy and performance throughout the life cycle of the medical devices. This is just only a kind of the benchmark that already done. So the SFDA and UKCA and CE, so the benchmark but done between three, we will find that actually the essential principles checklist is required by the Saudi FDA to getting the approval for the medical devices, and also is optional for the UK and Canada as well, and for the Europe or CE checklist is also required. This is just only standard that is using the checklist, actually ISO, IEC, and ISTA as well, general. So using standards, a manufacturer choose to use a standard. The standard will be appropriate devices, because actually each manufacturer for each medical device should be applied the applicable standard for the device itself, even starting from the low risk till the high risk. So there are different kind of standards actually, and for each device, for each class, and for each test should be applying the standard. Also, solution adopted by the manufacturer should be at least as linked to the standard. A justification must be made as to why international standard have not been applied. Also, if a standard has been partially applied, a justification must be made to explain why it has not been or why it has been partially applied. I think it's stuck. Okay, so horizontal and vertical standard, as I said, there are different categories of standards. So starting from the quality management standards, actually risk management, we are focusing on our biological and safety, usability of the medical devices, actually electrical safety and sterilization. We can see different examples for the devices, for example, X-ray machines, catheters, syringe, bandage, and scopes, and there are type of standard. For example, if we talk about the quality management system, we talk about the well-known and the defined standard ISO 13485 and its updated version. If we talk about the risk management ISO 14971, which is focused on the whole image for the risk, starting from the identification of the risk, management of the risk, and the risk mitigations and risk control. Also, if we talk about the biological safety, we'll talk ISO 10993, usability, of the medical devices, IEC 62366, and electrical safety, IEC 62366 as well. For sterilization, ISO 11137. The MD essential requirements and safety level. So we have 23 essential principles. So for the medical devices, we have 23 essential principles, starting from the general requirements regarding the design and the requirements regarding the information supplied to devices. So from section 1 to section 9, this is general requirement. General requirement, and for solution section 10 to 22 is focusing on the requirements regarding design and manufacture as well, and section 23 requirement regarding the information supplied to the device. We'll explain now the essential principle 1. The essential principle 1 is focusing on the performance and safety. So when pointing to the evidence, this essential principle is the most difficult as it covers the whole technical file. When we talk about the technical file for the device covering all of the aspects regarding the medical devices, tests, usability, biocompatibility, sterilization, design, manufacturing. So meeting standard purpose and performance is important, actually safe and effective with respect to the state of the art. We are talking today about the new trend era for the digital health, for the artificial intelligence, for the machine learning, and for the big data. And essential principles is applied to ensuring the continuity for the safety and performance and efficacy, and to ensuring the monitoring for the device in the post-market stage as well. So doesn't compromise the clinical conditions, because actually clinical conditions and the clinical assessment for the device is continuously monitoring through the life cycle of the device. We're getting more real-world data about the devices once it's released to the market and getting to using by the end user or by the healthcare provider. Then also doesn't compromise the safety of the patient, users, other persons, and benefit to the outweigh risk. When we talk about the essential principles, we must ensure the concept and the fundamental for the benefit and the risk ratio. Always thinking about the benefit for the patient, benefit for the end user. This is the nature of the medical devices, because actually manufacturers looking to producing medical devices, helping patient, helping end user for safety and for promoting health condition very well. So it's very important. The other side of the slides is just only covering the number of approved standard, actual standard, international standard, as I mentioned previously, for ISO 13485 for the quality management system. The quality management system, I can say it's a backbone for the medical device and the regulation. Without ISO 13485, nothing will be done for the medical devices or the regulatory process, even because actually it's starting from the manufacturer and it's actually reflecting by the end of the day on the usability of the devices in the market. ISO 14971 is very important to evaluate it. It's very important to identify the major component for the ISO 14971, starting from the identifying the risk, controlling the risk and mitigation and the planning, and actually the whole umbrella is the risk management. So it's very important. IEC 6061, also ISO 14155 for the clinical evaluation and the clinical investigation and the clinical trials of medical devices, also device-related standard. Essential principle 2, the requirement in this annex is to reduce the risk so far as possible, means that reduction of the risk as far as possible without adversely affecting the benefit risk. This is the essential principle 2. It covers two types of standard, actually ISO 14971, also clinical evaluation, and ISO 14155 for the clinical trials of the medical devices. It don't eliminate the importance of the benefit without considering the risk-benefit ratio. Risk-benefit ratio, as I said, is the most important concept that we are looking at this essential principle, and compare it with the safety for the device when it released to the market. Essential principle 3, the risk management system is closely aligned with the ISO 14971. And this type of principle, we focused on the quality management system and the risk management as well. So trying to make like harmonize and alignment between the ISO 13485 and 14971 in order to ensure the benefit outweigh risk from the medical device before getting approval and release it to the market. Essential principle for risk mitigation. So for the mitigation, why we need to mitigate the risk? Because actually all of the medical devices are risky, starting from the low risk to high risk. There is no medical device without any risk, because actually it depends on the interference with the body. Some medical devices, if we talk about the implantable devices and the bandage and the cotton, both are risky but different in the way of contaminate to the body. So we need to mitigate the risk, which is a part of the risk management profile, which is covered by the ISO 14971. Also controlling the risk through all of the life cycle, and actually it's a terms it's used in both pre and post phase, because actually controlling the risk, which is something maybe resulting from the device itself or maybe resulting from the usability of the device, and sometimes the risk may be potential or actual. If we'll talk about our colleague today to talk about work group 4, so they mentioned something like field safety corrective actions and field safety notice, which is when the device is placed into the market and there is a problem or there is a corrective action on the device, so that is actual. If we talk about the potential risk, that means talk about something which is proactively working on it in order to avoid it and reduce or eliminate the risk may be associated with. So essential principle 5 is focusing on the risk management system, is also closely aligned with the IEC 62366. The difference between the essential principle 5 and EB4 is the alignment, or actually with ISO 14971 on the IEC 62366. Essential principle. Essential principle 6, that it covers all devices have a lifetime, as stated by the manufacturer. The main pitfall is not declaring and justifying the lifetime of the device. Also, it's related again to the risk management, actually, ISO 14971 and actually 8061, all bars. So the other side of the presentation, this is what we are looking for when reviewing and evaluating the essential principle. We'll make sure to covering the standard which is mentioning in the right side of the slide. Essential principle 7. If software is transported and stored, if it's on the internet, actually, also it's focusing on the software, actually focusing on the packaging, actually, and not adversely affecting during the transport. It covers, it must be covered the ISO 14971, IEC 6061, IEC 8061, device relevant standard, and some standard like ISO 11607. Essential principle 8 also cover the risk management standard, ISO 14971, also clinical evaluation. I'll just skip some slide because actually essential principle 9, actually sometimes there are some devices without the medical purposes, but actually it covers the law of the medical devices, also includes some devices which are not medical devices but have similar risk to the medical devices. This essential principle covers this aspect. Also essential principle 9 deals with devices with no clinical benefits. Sorry. I think it's a problem with the... Essential principle 10, covering the biocompatibility. of the devices when it comes to related to the contaminated, or sorry, contacted with the human body. So there are different, as you see on the right side, many standards we are looking for before getting reviewing and approval for this essential principle, because of its importance actually when it comes to biocompatibility, either chemical, physical, or biological properties. Essential principle reference sterilization. Essential principle 12 also manufacturer who are not pharmaceutical specialists find they need to buy in expertise when they are incorporating medicinal products. It covers some of this aspect as well. Essential principle 13, also focusing in tissue scaffolding, tissue engineering for some devices which is already coming with the tissues. So looking for some standard and sometimes needs to doing like focusing on literature of these devices and how can get some scientific data prior to getting an approval. Essential principle 14 is about the general risk. It's cover all of the type of the risk and actually focusing on ISO 14971. We are working and related back to a 14971, which is the golden standard for the risk, and it covers actually all of the aspect of the medical devices risk. Essential principle 15 is device with the diagnostic and measuring function. Essential principle 16, covering protection against radiation as well. So there are some devices which is related to the radiological devices. So we need to focus actually on some of the tests and some of the aspects regarding the standard which is related to the radiation devices. Also, essential principle 17 is electronic programmable system and software. Essential principle 19, particular requirements for active implantable. Actually, it's focusing on active rather than inactive. So focusing on many standards related to the active implantable like pacemakers and other devices. Essential principle 20 is protection against mechanical and thermal risk. Essential principle 21, protection against risk posed by the patient user device supplying energy or substances. Essential principle 22, protection against risk posed by medical devices intended by the manufacturer for use for lay persons. And also, finally, essential principle 23 for labeling and instruction for use for the medical devices. So finally, the essential principle checklist for the RIC 1, which is one of the requirements. Actually, the regulatory scheme for the medical devices in Saudi Arabia is starting from the law, which is approved by the royal decree, then regulations for the medical devices and the requirements. For our requirement to getting approval and medical device market authorization, MIDMA, you should be covering the essential principle checklist, which is already stated in the RIC 1. Also, this is just one example, essential principle. If it's not applying the device, just only yes or no. If the essential principle doesn't apply, always give a reason. Also, there are this slide will be just only discussing the common errors comes with the essential principle checklist. For example, identification of device covered by the essential principle checklist is unclear. Also, justification not provided for claimed non-applicable essential principles. Also, non-applicability of general requirements, and also the version of the standard is incorrect or not declared. Methods of conformity are not listed or incomplete, and documents used to fulfill essential principles are not appropriately identified. Okay, that's all for me today. And actually, whatever I said about the essential principles, just only a little bit, not covering all things. But actually, we need to say that 23 essential principles is the most important for the medical devices, and the quality management system ISO 13485 and the risk management ISO 14971 is the backbone for the medical device regulation. Thank you, and thank you for listening again.
So much, Dr. Muhammad, for your beautiful presentation in a very limited timeline. So please join me in thanking our speaker for his valuable presentation. Give him applause.
Thank you.
Thank you so much.
Once again, ladies and gentlemen, give applause to Mrs. Irni Anggraini as our moderator for this session, and of course, our speaker, Dr. Muhammad Masrashi. Thank you so much. The next interesting material topic to be discussed will be personalized medical devices, will be moderated by Mrs. Chloe Tan, who is a secretary of ABAPMED Southeast Asia Center of Excellence. So ladies and gentlemen, without any further ado, please welcome Mrs. Chloe Tan.
Yeah, good morning, everyone. The speaker in the upcoming sections is actually Dr. Kadi. So he has actually obtained his PhD in Life Science in Karolinska Institute, Stockholm, Sweden, and also having a Master in Molecular Science. So currently, he is actually Associate Director from Garden Health, leading Asia, Middle East, and Africa. And he also used to be part of the Health Science Authority Singapore. He has prepared a lot of interesting materials to share with all of you. So without further ado, let's welcome Dr. Kadi.
Hello. Thank you, Chloe, for the kind introduction. So, I know that I'm standing in between you and the food right now. So I have prepared the presentation for 30 minutes, but I have been asked to reduce it to 15 or 10 minutes. I'll try my best to go as fast as possible, right? So today's agenda, I'll be talking about personalized medical device from IMDRF perspective, how they are seeing personalized medical device, how they are getting classified, right? So we'll start off with what is personalized medical device, what are the types of personalized medical devices, then what are the new risks with regards to the personalized medical devices, right? And then we also talk about the general pre-market requirements and post-market requirements for personalized medical devices. And then I will touch upon two key considerations. One is point of care manufacturing. The second one is medical device production systems. This is something unique for personalized medical devices because I will go through in detail, but then this is something unique which IMDRF published last year for personalized medical devices, which is MDPS system. So far, IMDRF has published 3 guidelines. One came up in 2018 for their definitions, and 2 documents with regards to the verification and validations of personalized medical devices, and also regulatory pathway on how they are getting classified, right? So I'll be basing my presentation based on this documentation. So what is personalized medical devices? The personalized medical devices are devices which are solely intended to be used by a single patient, right? It is not mass produced, right? But then there are 3 types of personalized medical devices as such. One is custom-made medical devices. The second is patient-matched medical devices. And the third one is adaptable medical devices, right? I will go through the definitions. With regards to the custom-made medical devices, it is used solely by an individual patient. However, a doctor or a healthcare professional will give a written authorization with regards to, we need this particular device to be manufactured for this particular patient, right? And then they will come up with the specification, and then the manufacturer designs as per the specifications provided by the healthcare professional, right? That is the custom-made medical devices. In most often or not, there is no off-the-shelf product available for a particular patient. That is the reason why the doctors design a device and ask the manufacturer to provide the device, right? That is custom-made medical device. I think I'll skip this slide due to time constraints. Now I'll move on to the patient-matched medical device, which is the second category, right? So this particular category, we need to remember a key word for whenever there is a patient-matched medical device. That is called design envelope. Let's imagine a particular manufacturer creates a device, but it can be used within the design envelope where they determine the lower limit of performance, upper limit of performance, and all the designs have been validated. So that is called design envelope. This particular type of devices are produced in batches. It is not produced in a mass produced, it's produced in batches. And then the responsibility of this particular for manufacturing this device solely lies on the manufacturer. However, the custom-made devices, the responsibility lies on the physician because he comes up with the decision, right? That is the key difference between the patient-matched device and the custom-made devices. A written authorization might still be warranted in some jurisdictions, but it is not mandatory as custom-made devices. The key word, again, I am highlighting here for patient-matched devices is the design envelope. So that within the design envelope, a device can be validated. It is quite good enough to be called as a patient-matched devices. I'll go to the adaptable medical devices. This particular type of devices is mass-produced. So first one, you can able to see, it is only for single patient. The second one is batch-produced. The third one is mass-produced. The only difference is that at the point of care setting, this particular device can be molded or adapted or changed as per the anatomy of a particular patient, right? That happens point of care setting, doesn't happen at the manufacturing site, right? So this is the adaptable medical devices. So there are three types of PMDs. So for example, in this particular case, we have a cranial reconstruction to be done. This device is mass produced. However, at the point of care setting, when it is actually delivered to the patient, it can be thermoformed or molded to a particular shape of the patient and then be used for the patient. So this is the adaptable medical device, which is mass produced, right? So what are the technical advancements and the challenges that we are facing, and what are the benefits towards it, right? Initially, traditionally, all the medical devices are manufactured in a controlled environment where we have QMS well established. They have all the essential principle checklists keyed in. But with the advancement in the technology, especially the 3D printing technology, the 3D printing happens at the point of care setting, at the healthcare facilities, right? When it happens outside of the controlled setting, then the QMS control is not there. I mean, there should be some kind of a regulatory oversight on what happens at the manufacturing site of the hospitals, right? So that is one of the challenges. It happens in a large scale right now. So that is commercial scale individualization is happening. That is because of the advancements that we are facing. But what are the benefits of point of care manufacturing? As I have highlighted here, it provides a timely access to the patients, right? It reduces the cost, especially with regards to the logistic distribution and delays. And then also the enhanced treatment. If the patient, in some cases, the patient can also be involved in designing the particular type which fits them well, which can be like a prosthetic arm or not. So point of care manufacturing has quite a lot of benefits, but it also comes with a risk. And that is the reason why IMDRF has proposed a medical device production system, which I'll be talking about in a little while, right? So I just highlighted this. So this chart, I have taken it out from the guidance itself. Basically, I'm thinking you cannot able to see it, but then the three main concept is that the first part, custom-made medical devices, is made for an individual patient. The second one is batch-produced, but within the design envelope. The third one is actually adaptable medical devices, which is adapted at the point of care setting, right? So this is highlighted here. So with regards to the product registration, I know this is text-heavy slide, but then please excuse me on this. But the idea is that customized medical devices, as per IMDRF, they are recommending the local authorized representative as well as the device manufacturer either to notify or get it registered based on the risk classification. But this does not happen currently in our region, right? Southeast Asia, custom-made medical devices do not require product registration. Only the dealer's licensing is applied, right? But then IMDRF do recommend to have a notification, or at least minimum a notification or a registration for custom-made medical device, right? But for the patient-matched medical device and for the adapted medical devices, they recommend full-fledged pre-market approval with regards to all the safety standards being accepted, right? Which is pretty much same as the current medical devices. But what to look out for during the review of patient-matched medical devices, as I highlighted here in orange, as you can see, the design envelope part. The technical documentation should be able to verify the worst case scenario between the lower performance and the higher performance of the particular device in order to do the validation for the device. This is something which we have to look out for in a patient-matched setting. With regards to the adaptable medical device, again, they do need to go under the standard pre-market and approval process AE, post-market surveillance, everything is included. And the risk classification is based on the mass-produced devices. But again, the key concept here is for the validated instruction should be provided by the manufacturer, how it can be thermoformed or adapted at the point of care setting. This is the critical information that needs to be provided during the validation process for adaptable medical devices, right? So what other considerations are provided by IMDRF? IMDRF touched upon 3 other points. One is medical device production system. The second is point of care manufacturing. The third one is materials to be used, right, with regards to the 3D printing and other devices at point of care setting. So this I previously mentioned, why we need MDPS. The reason why we need MDPS is because when the manufacturing happens outside the control facility, there might be QMS issues. We need this, right? So what is MDPS? Consider MDPS as 2 components. The first component is the resultant medical device itself, right, which is in the center green part here. The central medical device is it's actually a part of the MDPS. What other components form the MDPS is MDPP, which is medical device production process elements. So what are these elements? The elements are basically instruction for use of how to manufacture a device within the hospital, the raw materials, the equipments to be used for the manufacturing, and any other digital information or the files, CT scans of the particular patient to fit this particular manufacturing device to the patients, right? So all this component, along with the resultant medical device, is MDPS, right? So this is recognized as, so regulatory authorities, I'll skip these slides and go directly here. Considerations for regulatory authorities regarding MDPS. Treating MDPS as a device kit or a system is what IMDRF is proposing. So whatever components going into the MDPP and then the resultant medical device which is happening inside the hospital production is considered as a kit or a system, as a whole system, right? And also regulatory bodies can restrict this type of MDPS only for lower risk devices but not for higher risk devices, because at the point of care manufacturing for higher risk devices can bring in more quality related issues. And also using credentials, right? Only trained personnel within the entity, within the healthcare facility should be able to access this MDPS. So 3 considerations. With regards to the point of care manufacturing, IMDRF proposes regulatory bodies to use 3 different types of controls. The first one is manufacturing under special agreements with the healthcare facility, which is basically including MDPS or not, how they are going to do it. It has been explained quite well in the documentation. I don't have time. I have a slide for that, but I'll skip it right now. But basically, they need to have a QMS within the hospital. They need to track the device. They need to ensure that the documenting process with the manufacturing is there, post-market surveillance is there, and any feedback mechanism to the healthcare professional should also be there, right? With regards to MDPS, it is basically adopting the MDPS either from the manufacturer or from within the hospital who's producing the MDPS itself, which contains both the device and the components of MDPP. Then, of course, we always do the traditional method is fully regulating the manufacturing site. So if it is happening inside the hospital, they better have a full-fledged manufacturing ISO 13485 certification within the hospital so that they can manufacture such devices, right? So in conclusion, I would put the 3 key points is that there are 3 types of personalized medical devices. New manufacturing methods such as 3D printing creates new quality control related issues when it happens outside of the controlled facility. And then how RAs can able to leverage on these 3 types which IMDRF proposes to regulate the point of care manufacturing, right? So these are the reference documents published by IMDRF. And I would like to thank you all the people here for the opportunity that they have provided to me to share this presentation with you. Thank you.
Yeah, so thanks, Dr. Kade. So I hope you all enjoy the presentation. So let's actually send a round of applause to Dr. Kade. Thank you.
So once again, ladies and gentlemen, that was a very special topic from our moderator, Mrs. Chloe Tan, and of course with our special speaker, Mr. Karthik GMPSD. Please give a round of applause once again to all of us here. And finally, we have concluded the open ceremony and the open session. So I think after a very busy morning, we need to charge our energy. So after this, we will enjoy the lunch. But before that, let us inform you some important informations, ladies and gentlemen. For the first information, we will enjoy for lunch agenda. We will divide into two places, of course. First, at Montage Restaurant, are for SKM Pharmaceutical and Medical Device Industry Resilience, Directorate General Pharmaceutical and Medical Devices, GHWP TC meeting participants, and for speakers of CB regulatory. And the second place, you can find your lunch menu at here, Legion Ballroom. At the same place that you enjoy the coffee break is for the other participants. That's the first information. And the second information will be our next agenda after we enjoy the lunch. We will have a meeting agenda and we will divide into 3 rooms. Ladies and gentlemen, you can take a picture of this information. So at Uluwatu room is for GHWPTC closed meeting and it will be start at 2 p.m. And next, at ballroom in here, Legion Ballroom, we have capacity building regulatory will be start at 1:15 p.m. And last but not least, at Jimbaran room, will be meeting for capacity building industry, and it will be start at 1 p.m. So make it sure that you are at the same zone time, just for your information. And once again, I'll see you in each time for the next agenda. And of course, for the lunch, I think everyone is already know how to get the place, the montage area, or maybe our team will be inform you escort there. Once again, ladies and gentlemen, please enjoy your lunch and I'll see you on the next meeting agenda.